Good afternoon, everyone. This is Devika Batrai. I am one of the students at Cambridge College taking addiction and mental health, and I would like to welcome you all to this annual conference. And thank you so much for being here. Also, we are talking about the concurrent disorder. So I would like to present on my topic, which is implementation of enhanced cognitive behavioral therapy among the certain group of people that I will be telling you later. So let's talk about enhanced cognitive behavioral therapy. So it is a individualized treatment that has been mostly seen effective in the eating disorder, and usually there are different steps and phases and this therapy. And one of the article that I have chosen is evidence based article, and after reviewing the journal on implementation of enhanced cognitive behavioral therapy for adult with anorexia nervosa in an outpatient unit in a public hospital, which was published in 2018 in Bergen, Western Norway, concluded that it was successful in the targeted population, which was 44, but only 22 of them did the total session of CBT-E. So it was done on the targeted population who was 18 years and older, and on the special patient who had anorexia nervosa, which is one of the eating disorder, and the treatment was chosen based on the symptoms, severity, and the age of the targeted population. So the age of the population was 18 years and older, and which do not require inpatient treatment. So it's totally based on the outpatient treatment, and who were those patients who were not able to gain their weight. So the patient did not receive any other therapy. They were only receiving the CBT-E. The quality assessment project that performed a longitudinal evaluation of the implementation of the outpatient CBT-E for and during 2013 to 2014. So it took almost 1 year doing this research. So it's totally evidence-based practiced research. So the treatment team consists of 6 clinical psychologists, one psychotherapy, one psychiatric nurse, 6 clinical psychologists, one uh, psychiatric nurse, as I said. So yeah, the outpatient CBTE for underweight patients is delivered individually by the same trained therapist over 40 sessions. So there are together 40 sessions provided, and which was organized in mainly 3 steps. So step one, in step one, mainly they focused on providing education about the disorder, the anorexia nervosa, the consequences of being underweight, and this step usually takes 8 weeks, and it's totally based on education, and also helping the patient to change their decision and to gain weight. The patient participation participated in twice weekly session until they consistently gain weight. So the step two focused on achieving the weight regain at the same time, maintaining the body weight and maintain the eating disorder psychopathologically. So the goal is to reach the BMI, which was 19.0 to 20.0 kg per m square. The session in like one session every 4 weeks is dedicated to reviewing the process and the obstacles and designing the subsequent 4 weeks of treatment. So the third step focused mainly on the relapse prevention. This step usually lasts for 8 weeks, with appointment toward the end of the treatment, occurring at the interval of 2 to 3 weeks. The half of the 44 patient only completed the treatment, so the 22 of them left the treatment in the middle. In the remaining, there were a large statistical significant weight gain after 12 months. The percentage of the patient receiving the target BMI was more than 18 kg per m square, which was a success, and which was 36.4, 50.0, and 77.3 after 3, 6, and 12 months respectively. So the quality assessment project shows that it is possible to establish effective CBT-E in an outpatient eating disorder unit at public hospital or any outpatient clinic, or the therapy or the treatment, let's say clinic, even though the half of the patient did not complete the CBT therapy, but the remaining patient achieved a significant increase in BMI after 1 year the start of the therapy. So this result is a success in the half of the patient. So it helped to gain weight for the patient, uh, also with anorexia nervosa. Also it helped to maintain their body weight along with the relapse prevention. um, the research proves that CBT is effective among the patient with less severe complication and can be delivered through outpatient treatment. So the evidence provided in general are completely it's a evidence-based practice research, and the data collection information that provided, the citation that used, and the article was published on the National Library of Medicine. So it says that it's a evidence-based practice and research, and this article has also been cited by other articles in PMC. So moreover, the intervention helped explain all the steps involved and the results that are shown after 1 year from the beginning of the therapy, in which the BMI has been increased. So the article explained that the client can either be in the pre-contemplation phase or contemplation phase, as well as in the action phase, because, so as I said in the step one, even the client or the patient is not ready to make a change, or if they are not aware of the consequences of being underweight, then the um, therapist will give them education and then help them to make a decision and help them to make an action plan for a change. So even the pre-contemplation phase, patient or a client can achieve a success in this um, therapy or treatment. So the article doesn't provide enough evidence that this intervention will be effective in trauma client. So, however, I looked up into the different research which supports, which provides the evidence that it is effective in trauma patient, but mostly um, trauma focused cognitive behavioral therapy is effective among the trauma client. Whereas in some research, it says that the level of evidence varies from one to another, and they are limited for the highly vulnerable population. So yeah, it's mainly the different books by different authors, different articles. So is that cognitive behavioral therapy is one of the treatment in trauma patient, and they are interventing it in different clinics and hospitals. So gaps, talking about the gaps that I found in the article was, the author haven't explained why the 22 patient left in middle, and the question arises here is like, was it ineffective to the 22 to patient? So the evidence or the statement doesn't support or haven't given any proof regarding it, and the article also says that there were more adolescents in that group who left. So but even though there were few adolescent in the last 22 patient till the end, but as I said, the gap is that we haven't provided us the evidence to support that statement. Um, and my references are these. So thank you so much for participating in this conference. If you have any question regarding my presentation, then please feel free to ask. I'm ready to answer all your questions. Yeah, thank you so much for listening to me, and have a good one. Bye, everyone.